Hi there, and welcome to this presentation for the ORAHS eConference 2020. My name is Sean Manzi, and I'm going to be presenting today the beginnings of my fellowship project on network-based operational modelling of healthcare systems to support service improvement. This project has been funded by the Health Improvement Studies Institute, this institute in the UK, and is running for 3 years. It began in December last year and will run until 2022. The aim of it is to develop a whole system modelling platform to support mental health service improvement. And we're going to take a look in this presentation at exactly how I'm planning to achieve that and where I'm up to thus far. So the project itself can be split down into 3 different stages. The first is a study of service improvement metrics, and the aim of this is to understand what kind of measures mental health services are using when they're undertaking service improvement projects, or what kind of measures they'd like to use to understand what the impact of their service improvement projects are. This is going to be done in 2 ways. A national questionnaire is going to be sent out to all the mental health trusts in England to understand at a very high level the kinds of service improvement measures that they use and the context in which they use them. The second stage of this is going to be a service improvement records review, and this is going to be a deep dive into the kind of service improvement project records of a local trust down here in the southwest of England. And in that, we're going to look at the types of projects that have been undertaken, whether any measures of service improvement were used, which measures they were used, and also which measures could have been used, what might have been appropriate during those projects, to try and get an idea of both the scope of measures that are used, but also the kinds of projects that are undertaken and which measures might be really useful but haven't necessarily been applied before. This itself will actually lead on and inform the development of a network-based operational modelling platform. And the key part of this is that it's to be able to monitor and identify service improvement needs across an organisation. And this is the element of the project that we're going to focus on in this presentation today. The third stage of the project is looking at platform testing and refinement, and particularly the development of training materials to help people to use the platform effectively and also interpret the outputs that we're getting coming out of the data exploration from the platform. Now, because of COVID and the need for health services to reprioritise what they're doing at the moment, I've had to swap around stages 1 and 2 of the project. So at the moment, I've been working on the development of the network-based operational modelling platform itself. And this has been coming on at quite a pace, and I'm going to share with you today where I am with the development of the platform thus far. So just to get us thinking a bit about whole system modelling and operational research, it often focuses on strategic level and policy level planning. And this is because when you have a large model, the level of abstraction tends to be higher because the model becomes incredibly complex. The larger you make it, the more elements in it and more data being required. But it's this interaction which is really, really important within a whole system model, because you need to be able to understand all the interactions between all the different, as many components of the system as you can, in order to be able to gain that complete picture and gain a deeper understanding into how the system is actually constructed and is working. And this is difficult due to the complexity of the systems themselves, and the amount of information, data that's required in order to actually build them. With whole system modelling in healthcare, it really is essential that we consider cross-departmental and cross-organisational interactions. Healthcare services don't operate in isolation. They are constantly working with other services and organisations in order to be able to provide care for their populations. Now, system dynamics has been used as a central approach for whole system modelling, and this is because of the ability to abstract a system at a high level. And there's examples of this for stroke care provision. So stroke care operates across emergency, acute care, high intensity care, also then going into rehabilitation and long-term aftercare. And so that's lots of different departments and services all operating together, and they need to be coordinated when they do so. And that's difficult to model because it is a very large system that operates over a long period of time. Emergency care coordination as well, where you've got emergency departments, but also the ambulances, air ambulances, fire, police services, all operating together to provide emergency care coordination. And that, again, as soon as you start bringing in these different organisations and all the different services, you get these large, very large and complex systems emerging. A recent example from the Whole Systems Partnership is a COVID-19 impact on healthcare pathways example, where they've used system dynamics modelling to look at the impacts of the COVID-19 pandemic on care provision at a hospital in Kent, and being able to look at how it's impacting on different departments and services and planning for capacity requirements. So these examples are very large systems, but one of the issues with system dynamics is that the model itself is only built as a one-off static representation of the system. It can't be generalized to other times when services and systems, services and departments might change. The interaction between those departments might change. When they are built, they are a representation of the system as it is statically now. And the data that's then used to parameterize that model is a singular set of data that is relevant to one time period. The generalization of that forwards and the reuse of the model at different time periods is difficult because of that, the fixed model and the fixed data set in it. If you were to update the data set, you'd have to undertake all the analysis again, and different departments might be involved. Some might have been changed or anything, so you'd have to rebuild the model as well and revise the model. One approach to overcome some of these issues is graph theory, and graphs can be used to represent relationships between departments and organisations, and we can embed information about departments, services, organisations within the graph itself, and then we can amalgamate the graph in different ways, looking at the kind of the level of abstraction and subsetting the graph as well. So if we're using a graph as a whole system model, the graph itself is the service structure. That is your system. And the nodes within the graph can be thought of as the services. Those are the services that are being provided to patients, your departments. The edges then are the movement of patients between services, and the edge weight can be thought of as the number of patients that are moving between services. And then we can attribute different information to the nodes, and these we can use as our service improvement measures. So we can have things such as waiting list length, waiting time, referral to treatment time, any kind of service improvement measure that you might think of using, and we can embed that information within the graph. So when we're trying to develop a platform to utilize this graph-based approach, there were some key functionality and kind of usability specifications that I came up with initially. And these have guided the design of the platform thus far. So one key element was to be able for the user to be able to upload their own data. And this has to be a simple data set in a way. And what I've done is developed a way of graphing healthcare systems that uses a very minimal amount of data. It uses individual patient records, using only referral and discharge dates, and the names of the services kind of as the minimum amount of data that you need to be able to put in, which keeps it's using data that every healthcare trust generates, so everybody can use it. Everybody will have access to this level of data. A network visualization is absolutely essential here. This is what we're trying to do. So we need a good way to be able to visualize the healthcare the health system as a network. The use of individual statistical process control charts for all of the services was something that I decided to build in predominantly because this is what a lot of trusts are using now to monitor their performance and to identify if they've got special cause variation happening, which is outside of normal levels of variation for the provision of service. I wanted to build in some metric comparisons so that you can compare between services and start looking at how different services are functioning, and to be able to monitor them in comparison to one another. And to be able to look at this over time. Time series comparisons is absolutely essential, because this platform aims to be used over a longer period of time, that you can look at the changes in service provision and the changes in service structure over any kind of time range, and have that real generalizability to it. And to be able to produce reports. So it's all very well producing these visualizations and lots of numbers out of it, but to be able to produce a coherent report very easily, to enable analysts, healthcare analysts, to make use of the system without having to spend lots of time copying and pasting graphs out and visualizations out of it, or manually writing out figures. Want kind of automated report production coming out of the platform itself. And then in terms of usability, this platform needs to be easy to use. Graph theory can get incredibly complex, and you can go down all sorts of interesting rabbit holes with it. But actually making something which is easy and intuitive for people to both use and then interpret was really key here. I didn't want the learning curve with it to be too steep, that it's intuitive enough for people to grasp that a node represents a service, and then you can abstract it out to different levels and how it's amalgamating data and representing their data, and that they can see their system in it. And yeah, the target audience here would be healthcare analysts. So they have understanding of data analysis and also an understanding of concepts of data science for manipulation of data, so that they're understanding kind of what's happening in the background. And the secondary audience here is clinicians and management. So once data extracts have been prepared by the analysts and they've done a first cut, clinicians and management can also look at the data and look at it within the platform. So what's this going to do for service improvement? Well, the aim is to be able to identify special case variation across the system in order to be able to identify where an intervention might need to be made to make a change within the system. And to look at changes in departmental interactions, but not just their interactions, but also the impact of one service, a change in one service on another service, and how these changes are propagated through the system, and what the knock-on impacts of making a change in to service A are on service E that might be on the other side of the system, how you get these knock-on impacts through. And that's really key for monitoring the impact of service improvement projects. So you can make a change in one service, but what is its impact within the system? It might work, it seemed to work for that particular service, but it might just cause an issue further down the line. At the moment, we don't know if that happens. This is a way to be able to understand if it does and what those impacts are. And then there's the opportunity to be able to do prediction as well, to be able to look at the future state of the system, how that might change over time, and also beginning to predict individual patient care requirements, particularly as mental health care provision tends to be quite circular, as that people will go through cycles of care, and being able to predict when that might occur would be incredibly beneficial for mental health services in terms of their capacity planning. So I think we should have a little look at the platform itself as it is thus far. So I'm going to bring up a live version. I've got some screenshots within the presentation for people to be able to have a look at later, but I've just brought up this live view of the platform itself. So the landing page here is kind of the introduction and instructions page. This will give an introduction to what the platform's about, the data format that's required in order to make it work, how to use the platform, and online training. So there'll be a series of videos and exercises that will accompany the platform itself, so that people can upskill themselves and make sure they're getting the most out of the platform. So if we move on to the next page, which is the data upload section, there'll be instructions on how to upload the data. People will be able to just select, or drag and drop, or select their data file that they want to input. The data will then be passed in the background, and any upload or parsing errors will be thrown here, such as columns not being available, not in the right format, particularly with data. We have to make sure that that's all in the correct format. But that will all be done automatically in the background, and there'll be useful errors that'll be presented if something has gone wrong. But the code itself is being written to be able to handle a lot of different formats and just to reformat the data as necessary. A summary will then be given of the uploaded data, and some cleaning tools will be available. So we can remove excess white space, convert the text to lowercase, because this helps if you've got the names of services, some of which have been written all in lowercase, some have capitals, and you just end up with replication of service categories. So got some good data cleaning options, and additional ones will be added during the platform development process. And then flagging any entries which are, for example, they have negative dates on them, or things like that. Anything which is odd can be flagged for removal, save somebody coming out, having to change their data and then re-uploading it. There'll be standard options for removing possible issues in the data. So once the data is all read in and uploaded, the next stage is going to be producing the interactive graph network, which will be presented here in the network overview. And there'll be options to change the level at which the services are aggregated, and to be able to subset the graph based on different attributes and values. And then there'll be some network summary statistics provided as well. And one of the things that stage 2 will now do, looking at, and stage 3, looking at the service improvement measures and looking at the testing processes and with users, is to work out what are the most informative metrics to be providing around the graphs themselves. And when doing the data exploration, what do people actually want to know? The next, so for every service or every node here, also going to produce the statistical process control charts, which will be here, and you'll be able to select the node and look at use different SPC chart types. And then also a node attribute comparison. So you'll be able to compare all of your nodes, all your services, based on a particular attribute, which will enable this kind of comparison across, and this view across the system of what things like your waiting times are across your entire system in one graph. I think that's quite useful, and all evidence seems to point to the health service seeing that as quite a useful tool. And the next one, this is where it gets really interesting, that we get a dynamic interactive network. And this is where you can split your data up by time between a particular time range and given a particular time slice size, and be able to look at the evolution of the system over time as it moves through time, and you can see how services are being used, not being used, interactions between different services, how they're changing over time, and how particular attributes might be changing over time. Because we can look then at attribute time series for the whole chart itself, and also by service individually. We can look at different service attributes for different services and look at those over time, and compare them between services as well. And finally, they'll be able to produce reports as well. And until the rest of the platform's been built, the reports will remain undetermined, because until we know exactly what data is going to be available and how best to produce the reports, that's something that really needs to be worked out with the analysts themselves to make it as useful as possible. So that's a brief overview of the platform as it stands. And as you can see, there are stills in the presentation for you to have a look at if you'd like to. So the platform development is progressing well, and I'm going to continue developing that, and I'm hoping to have a prototype platform ready by the end of the year. This will be made available on the project website, and so if anybody wants to have a go with it, it will be up there for them. And I'll be doing a lot of tweeting and letting people know that that's there to have a go with and have a play, and for people to feedback on, because it's going to be that feedback process of usage which is going to be absolutely essential for coming up with a really usable and useful whole system modeling platform. Next year I will be, hopefully, all being well, that kind of COVID keeps itself a little bit quiet, that we'll actually be going in and looking at the review of the service improvement records and the national questionnaire to understand the service improvement metrics that are being used. And then be looking more at data visualization and functionality testing, and this will be we'll be having workshops with the healthcare analysts themselves and getting their feedback on the platform, and yeah, lots of testing and refinement just to work out all the bugs, and there will be lots of bugs, I'm sure of that. And then there'll be a whole process of dissemination. The platform's going to be released as an online platform, but it's also going to be released using Docker and Binder, which are two different ways that you can containerize Python projects so that they can be used by lots of different people in different ways. It will also be packaged up with as an exe installer, so it's nice and easy to use on a Windows platform. And then I'm going to go around and showcase the platform with various mental health trusts around the country. Try and drum up some interest, really, get some feedback from different trusts, see what they think. If they're interested, help them get it into their day-to-day workflow, because I think that's a really important element of the actual end implementation. This is something to be used, so it'll be incredibly worthwhile actually going around and doing that implementation element. And of course, plenty of publications, sure. So I'd like to thank you very much for listening, and please go to the project website, which is project-nom.com, if you'd like to find out more. And there's lots of information. I'm kind of using that as a repository for anything that I'm producing related to the project. So there's already a training video for an introduction to Dash with Python, which is the package that I've been using to build the platform, which integrates Python functionality with HTML, CSS, JavaScript, jQuery, and that there's an introduction if you're interested in building your own kind of interactive web apps, and lots more to come. Lots of different training opportunities on there, and opportunities to get in contact with me as well. And of course, the platform itself, hopefully end of the year, that'll be up on the website. Thank you very much.